Hello, everybody, and welcome back to the Midland Health Podcast, healthcare that makes you proud. As I've asked in every one of these podcasts, please go hit that subscription button. We are trying to get to 2,500 subscribers by the end of the year. We're also interested in what kind of content you want to hear from us. So add a line in the comments if you want to put something down there about a topic or a guest that you'd like to see on the Midland Health Podcast. Please let us know. We do have a few blank openings through the end of the year that we want to fill in some topics or guests that are being asked for by our viewers. So let us know what you're interested in hearing about in some future podcasts. Today's podcast, my guest is Gran Shinwar. Gran is the Chief Executive Officer for Permian Basin Behavioral Health Center, where he's going to lead the efforts to expand access to high quality behavioral health care as the organization prepares to open and begin serving communities throughout West Texas and Southeast New Mexico. His leadership is centered on ensuring those facing mental health and substance use challenges have access to compassionate, effective, and timely care close to home. Gran, welcome to the show.
Thank you for having me.
Yeah. So to start, tell us a little bit about yourself, your career, what brought you to Midland and the Permian Basin Behavioral Health Center role. Tell us about your history in mental health services.
Sure.
Tell us a little bit about yourself.
So I'm most recently coming from Chattanooga, Tennessee, where I was fortunate to oversee an operation of about 140 beds in behavioral health. But I started my career in acute care, and I was on the quality side of things, that person that was conducting audits, reviewing records to make sure that we're providing the best care possible. And that's where I really cut my teeth, so to speak, and really learned about healthcare. I've been fortunate from there. I stepped into behavioral health care, and I've been in this space for about 15 years. I've been fortunate to have moved around the country and experienced healthcare delivery from all walks of life, many different states. And I've been very, very fortunate to have been part of larger institutions that really have done it well. So HCA, UHS, Acadia Healthcare, those experts around behavioral health. And so now I found myself here in Midland, Texas, and part of this vision, or I've seen this vision around what the Permian Basin is looking to do in providing access to healthcare. And for behavioral health, this for me is something that's extraordinary. And just to be part of this mission, this vision, I couldn't ask for anything else greater than to be part of this.
I know whenever I first met you, one of the first couple of times I met you, you said you flew out here to do the interview and to say no.
Yeah,
You're like, I
yeah.
just feel like I need to go out there and check this box and have been on the site visit. But tell us about what your experience was when you got to Midland, when you toured the facility, when you met Russell Myers, who's been leading our behavioral health center board, was my predecessor at Midland Health.
Sure.
Tell us what happened to your plan to come out here and say no.
So that's a true story. And I remember when I got the phone call about, the information about the facility, where it's located, and I didn't know too much about Midland, Texas. I hadn't been to Texas except for to Dallas Fort Worth. But when I arrived here, I was able to tour the facility, and I'm used to seeing new build behavioral health hospitals. And all of those new builds, they claim to be state of the art. And I was able to walk through this hospital and see really the effort and energy that's been applied to provide something that is next generation. It really blew me away. Um, it's something that really spoke to me instantly, that this is something that I could be a part of to really meet the needs of the community, but then also internally, intrinsically receive some gratification, because there's nothing better than helping people, helping those that are underserved, helping those that to me are a vulnerable population. And that's what behavioral health to me is. Those that are suffering from behavioral health or substance abuse are vulnerable. And when they come to a space such as ours, they are giving up their rights, and a lot of trust is involved there. So I view it as a privilege, and then to be a part of this with Russell Myers, you can hear it in his voice when he speaks about the facility, the stakeholders in Midland and in Odessa that have come together to really make this a reality. It's something that is, for me, a dream come true, but it's also an ability for us to provide uh, the premier behavioral health service that you could find anywhere in Texas. And I think it ultimately could become a destination facility, not just here for West Texas and our municipality and our locality, but then also the greater Texas region and then the southwest parts of the United States.
Yeah, I think so. I think we're really excited to have something like this in West Texas. We don't have anything like it today and haven't, and the need's been there. It was really a passion for Russell to address mental health care in our region as he was preparing to exit his role at Midland Health, and so for him to be able to pull this off, obviously a lot of this happened. The foundation started with Speaker Craddock and Representative Landgraf in Ector County, who worked together at the state level to provide significant down payment to get this facility constructed. But it wasn't enough to get everything done. Russell and our foundation, the folks at Medical Center in Odessa, we worked with philanthropic donors in our community and really across the region, even getting support from other healthcare institutions that are going to depend on this facility, raising a significant amount of additional money to get this place up and running. So it's been a really a very exciting time
Yeah.
for Midland Health.
Yeah.
Certainly being involved in it from my, but for the region, I think the community's really excited about this, and we're really excited now to have a CEO in place that's going to come in and really start to put that vision to work.
Mhm.
And so we're really excited to have that coming on later this year. So let's talk about the basics. What is the Permian Basin Behavioral Health Center? What's it going to be? Why is it important to our community? And how will this facility help people during a mental health crisis?
Okay. So it's a little bit different. So, in one end, you've got a traditional hospital, a behavioral health hospital. And I say traditional, but it's not quite traditional because we are able to offer a lot of services that aren't typical in a psychiatric facility. And we're able to treat a lot of populations that oftentimes aren't able to receive treatment. So, the populations that we're looking to serve are adolescents, your adults, your geriatric population. And something that for me is amazing is that we'll be able to treat pediatrics. And that to me is a little bit different because there's not a whole lot of pediatric programs in the state of Texas. But in addition to that, we will also be able to provision ECT services within our facility. And some patients that come
What
in.
are ECT services?
Okay, so
I'm well versed in when I use acronyms. People tell me, whoa. I don't work in your world. What's that mean?
okay, so I try not to butcher this, but electroconvulsive therapy.
Okay.
So in a nutshell, what this treatment does, it generates a controlled seizure that really allows the brain to reset, and it gives a method for us to target those folks that have depression resistant forms of diagnosis, and really give them just that extra level of treatment that perhaps medications and therapy aren't working for them.
And that's not common in a lot of facilities like ours.
Correct, correct, because it involves medical care,
Yeah.
right? So bringing in anesthesiology in, and there's always potential risk with any type of procedure, but it's that comfort level, finding the provider that's willing to perform the procedure, and really having the environment to perform the procedure in. So again, a facility that is state of the art, next generation to provision the suite for this is phenomenal. And then in addition to ECT, we're talking about also provisioning IOP, intensive outpatient programming, partial hospitalization programming. These are hospital based outpatient services. So once you have finished your stay at our facility, you have the next continuum in care and you're able to step down into a less intense environment and you're still able to either see a provider or a therapist and continue to receive treatment. So that's the hospital in a nutshell. So what makes this place special is that it is more of an integrated delivery system because we will also have this wonderful partnership with Texas Tech, and Texas Tech will be providing the medical care, both psychiatric and medical, for the hospital, but they will also have space on the second floor in terms of their ambulatory outpatient clinic. So one more addition in that terms of the continuum of care, and then also, we're looking to bring on Permian Care, our local mental health authority. Bringing those folks on site, it becomes a hub. And the reality is, what we are turning this facility into is a hub of mental health care for the entire West Texas region.
Yeah. It's exciting. One of the things you hit on is one of the coolest parts of I think the facility to me. We appreciate that foundational information, but take it a step further. Let's talk about something you hit on. Who can receive care and talk about the populations of people that we're going to serve. I think that's one of the things that make this place different. The
Yeah.
the range of ages and type of patients that we're going to treat there.
Yes. So for the adolescent population, you're talking between 12 and 17. For the pediatric side, you're talking between 5 years old, as young as 5. I know it's heartbreaking, but this is the wonderful thing that we get to do. It's a silver lining to provide the service, and those children that really need services are able to acquire it here. So between 5 and 11 is for the pediatrics. And then, of course, I had mentioned earlier about geriatrics. So that's going to be for your older adult population. It is going to be equipped with an environment that is more appropriate for those folks that are a little older, a little bit more challenged to move around in terms of mobility, and those folks that may have a little bit more medical complexity. As we get older, we need a little additional TLC, and that environment is conducive for that population. For PHP and IOP, right now we're talking about when we open, we're going to have, services both for adults and adolescents. But the reality is, we eventually want to build that out so that way we have a mechanism for all populations to be able to step down and have a continuum of services.
Yeah, I think that's really one of the things I'm excited about is the range of people that we're going to be able to help and the way the building's been constructed. Just like in a hospital, there's a pediatric wing, there's an adolescent wing, there's a geropsych wing. So all the patients are separated and they don't interact across different age groups.
Correct.
It's like their own little mini hospital in
Very,
every wing.
very segregated, so that way we can ensure the safety of all the patient
Yeah.
populations. And I'll probably add on to the services, because something we haven't talked about is really upfront. When patients need care, where do they come? And you had mentioned, hey, what type of patient, what person can step into the facility? The reality is, we'll be provisioned to handle anyone that walks through our front door. We will be integrated not only with Permian Care and Texas Tech, but also with our what I call our sister facilities, Midland Memorial and Medical Center in Odessa. So those folks that may have a medical condition that we cannot treat, we'll be able to partner with them to ensure that they get the medical care, and then we'll bring them back for the psychiatric component. And what I will say is different. We are working towards enhancing our capabilities that are a little bit more unorthodox for a typical psychiatric facility, so we can handle some of the more minor medical conditions internally more safely, so that patients do not have to board within an emergency department, and we can bring them in. Those folks that are having a crisis can come see us, and we can perform an emergency medical screen. We'll have a observation unit for folks that, hey, may not meet inpatient criteria, but we'll have a safe place for you guys or whoever, for the greater community to come in, and we can perform some form of intervention that you may not need inpatient criteria, but we'll have a form of intervention and be able to crisis safety plan you back into the community just in case. So we kind of are treating all modalities, all potential possibilities we're looking to be able to treat and manage.
Yeah, that's going to be one of the great things I think about this facility is it is a joint venture partnership, 50-50 with Midland Health and Medical Center Health System. And so us partnering on this and being, as you said, we're friendly hospitals that are a
Yeah,
part of the management and certainly the board oversight of this facility. You know, a lot of the backlogs that happen in both of our facilities, either in the ER or even a bed upstairs, is we get that psychiatric patient that needs some type of mental health services that can't be offered at our facility at Midland Health or at Medical Center. They're not
yeah,
acutely ill. They don't have pneumonia.
yeah,
They don't have anything else going on. And they sit in our ER or they sit in a bed upstairs for 2 or 3 days. And we're trying to find some facility that will take them
yeah,
and get them, the care that they need and also get them out of our emergency room, backing
yeah,
up care for other people that we can take care of. So I think it'll be a game changer for both of our organizations to have this for a number of reasons, and it's going to be a great benefit to the patients in our community to have this kind of a facility that's local and
yeah,
having the partnership where the three of us are all working together, pulling in the same direction. I think will make it really efficient and
yeah,
seamless for patients. So if you do show up in the emergency room in Midland and you are having a mental, you don't know where to go, you don't know what to do, we're friends with the Permian Basin Behavioral
yeah.
Health Center. We'll make that call. We'll do the assessment. We'll get the transfer done so you can get to the right location of care. So it's really going to be great. I can't wait for this to get rolling. It's great to hear that PBHC will be able to serve all these different demographic of patients in our community. Let's take a look at the treatment options that are going to be available. You talked a little bit about inpatient and outpatient. Give
Yeah.
us a little more detail on what's going to happen there in your vision when we open.
Okay. So the reality is, our for inpatient care, there's a lot of things that are done in our hospital, right? So we have providers that are able to conduct psychiatric assessments, um, and provide medication management. Internal to that, we will have clinical services that will be able to provision therapy. So that is in the form of group therapy, individual therapy, and then we will also help facilitate the case management aspects, really about returning patients back into the community, ensuring that we have good safety plans in place so that folks are reintegrated into the community. So in PHP and IOP, those are very therapy driven. Again, the intensity is a little bit different. For PHP, you're talking about an outpatient program where you're getting groups maybe 6 hours a day, but you're able to go home. And for IOP, is a little bit different, but same modality in terms of being very therapy driven, but that is multiple times a week, but 3 hours a day. But that allows you to perhaps continue working. So it really depends on the intensity that's required. Inpatient is really the highest, and where it is a fully locked facility, a number of individuals will come into our setting that may not be safe to manage themselves at home or amongst others. So they are members of our community that come in for treatment. And the reality is, we work through our capacities of inpatient and outpatient treatment to get them to a state where they're functional and able to go back and reintegrate into our community.
Yeah, that's a great thing to have this set up, and have that inpatient service. I know when you think about somebody coming to the hospital to Midland Health with a heart attack, and we recognize that in the ER, we take them back to the cath lab. Maybe we put a stent in, we mend them for a couple of days, and we send them home. But
Yeah,
we're not done, right?
correct.
There's hey, you need to follow up with your cardiologist. You need to follow up with your primary care provider. Tell us a little bit about what happens when you have that inpatient person and
Yeah.
they're ready to now reintegrate. What kind of relationship does the facility have with that patient ongoing to make sure
So
maybe they never need that inpatient admission again?
absolutely. I mean, our whole entire hope is that it's one and done, right? Patients enter our facility. Um, Oftentimes, it doesn't take much, right? Any one of us in any type of situation can incur some form of trauma or some life changing circumstance, and you may end up finding yourself in a state of crisis. And I think what's quintessential is to understand is you can come to us, and either it be a minor issue or challenge or just a concern, we will help either by calling us, connecting with one of our intake clinicians, or coming to our front door, walking in, and just being in a heightened state of crisis and anxiety. We're going to be there to help you. So, through the course of an admission, a patient is triaged. We determine the appropriate level of placement. Um, Either that is in our observation area where you don't quite meet inpatient admission criteria, but you'll receive care. And that's one of the beauties of being in our setting as opposed to the ED, because in the ED, there's not a whole lot of behavioral health services that at your disposal to leverage for a patient that walks in. In our setting, it's a little different. We could even start inpatient treatment in that setting, and we will have an ability to leverage other resources even in that observation area. But the ideal state is, hey, someone comes in, they're in a state of crisis, they receive an assessment, we work with them, their family, we educate on what's going on, we connect with the physician that determines, hey, this patient meets inpatient, potentially outpatient criteria, IOP, PHP. Maybe they're better suited going to the ambulatory clinic with Texas Tech or to Permian Care. We have now a lot of ability and capability now that we're a one-stop shop, so to speak. And so that patient will come through, receive treatment over the course of, on average, 6 to 10 days. It really depends on the
Sure.
population that's receiving treatment. And then on discharge, we have case managers and social workers that really start on discharge from day one or at the initial stages of your admission.
Begin with the end in mind. Yeah.
Exactly. We're already starting that process and identifying, hey, what's the end game? who do we need to connect this individual with in terms of community resources, aftercare appointments, and by the time a patient departs from us, there is a robust plan that articulates, hey, this is what I'm going to do the next 7 to 10 days. This is who I'm going to connect with. I've got my appointments already established. This is where I'm going to go. And we're going to look to eventually over time make that even more robust. There's some additional ideas that I have in mind I won't share today,
Yeah.
but things that I think aren't very common. But I think this is the beauty of working in this environment. We can be creative.
Yeah.
And the reality is, what may be the norm will not be the norm for us. We're going to be thinking outside the box, developing new strategies, new solutions that makes the patient experience that much better and really will become the talk of the town and talk of the state when it's like, hey, why would I want to go to Houston or Austin for care when I can go to Midland, Texas to this next generation facility where the care actually matches the facility and they actually care about the patients once they discharge. So that's the vision I have in mind, is that we don't stop once a patient leaves here, but we're all about how do we change the health of the population that we are here to serve, the greater community. Overall and over time, we want to mitigate inappropriate inpatient admissions. We want to see inpatient admissions decrease. We want to push those admissions out to outpatients, which tells me that folks are seeking care uh, via other methodologies so that they don't need this high level of care.
Yeah, when we started talking about this facility, it's probably been over 5 years ago. Whenever Russell first had the idea of maybe this is something that we need in our community. We had a lot of data, and some of it not great, not informational around what is needed.
Yep.
What can we see why people leave Midland and go to Dallas or Houston or Lubbock or wherever it may be? What kind of care do they need? And we kind of built the facility around those data points. Here's
Yeah.
here's the information that's readily available to us, that we can see that people in our community and in our region are needing. Let's build the facility that would deliver that care here. I think the great thing is, as you hit on, you mentioned working for a couple of big corporate environments. I
Mhm.
worked in a corporate environment at one point. It's a great place to learn how to run the
Sure.
business, and it is difficult, and having that knowledge is valuable. But I think the benefit of working at a place like Permian Basin Behavioral Health Center or at Midland Health, the one of the things I love most about my job is, we have a supportive community. I have a supportive board. You have a supportive
Yes.
board. I know a couple of your board members. Uh, is this is a starting point for us.
Yeah.
It's not probably our ending point. We're gonna get real information,
Right.
as we really open this up.
Yeah.
We've often said that as this place opens and start to serve the region, we may learn things that we didn't learn,
Correct.
did not know 5 years ago when we started talking about this, and we may need to adapt some of the services that we
Absolutely.
offer to really address a population that we didn't know existed, that it was out there. People that are going without care, that are struggling every day, that are really on the cusp of having some kind of a serious crisis or breakdown. I think having this available will open it up. So that's what we've talked a lot about as
Yeah.
you've come into the role. Our board's talked about it for years as we've started this. Is we need to be prepared to be nimble and react to what
Right.
the needs are.
Yeah.
And you can't do that necessarily overnight. Some things are easy to resolve. Some things will require planning into the future. But again, that's another exciting thing is we're going to get information, and we know we have community support to expand the services that we can offer to make sure we're meeting the real needs, what presents at our facility and the healthcare and mental health that people need. Gran, this may be the most important question that I ask you today. If I'm a listener, if somebody out there is watching this podcast and they're listening to this story and they recognize that maybe they need help now, that maybe they're not in crisis, but they're nearing a point, and they hear this story and they think I need to seek some help, or maybe they know somebody in their family or a friend that needs this. What should that person do to get care today?
So I think the reality is this: the facility will be open soon, but if you're in imminent danger or an imminent need for services, you really should immediately call 911. Now, there are still other opportunities, and you can leverage those opportunities through your primary care provider, going to Midland Memorial, going to MCH, or just whoever your outpatient provider is. But the reality is, you shouldn't wait. You should immediately seek out help as immediate as possible. And if that doesn't work, and you're looking to reach out just to have a conversation, there is a national hotline. There is the 988 number that we can reach out to, that can provide services or at least facilitate coordination. But immediately seek care as soon as possible. If there's imminent danger, please call 911.
The Permian Basin Behavioral Health Center may be open by the time that you see this podcast, but we'll put some links in the description for the 988, for Permia Care, for both the hospitals, for the Permian Basin Behavioral Health Center, for Texas Tech Psychiatry Center. We'll have a lot of links down in the description. So if you're hearing this and you think I need to do something now, there will be some links available to you, and you can find what services are available in our area, and make sure, as Grant said, don't wait. The most important thing to do is, if you think you're in need of help, is to seek it immediately. So thanks for sharing those resources. I think even as the Behavioral Health Center opens, having a plethora of resources is important to our community. And maybe they're not comfortable coming to the facility, but they are comfortable calling 988 to get access to some other resources. So making sure all those are visible to our listeners and our community is important. So to wrap us up today, I'll give you the floor. Anything we haven't talked about that you want to cover, any important topics with the Behavioral Health Center, or just mental health care in general that you want to cover with our listeners?
I would say that it's been phenomenal thus far being in Midland, Texas. You know, all the folks here have been warm and welcoming, and it truly has been a pleasure. And I'll say this just on a personal note, that my wife loves it here, which means I love it here. But I think the reality is to be part of this mission and vision with Russell Myers, yourself, the rest of the board, um, knowing that we leveraged a psychologist, Stephanie Caples, in helping build the facility. Again, this is a dream come true, and I think the reality is, this level of care and ability to treat those in Midland and the greater Permian Basin area is going to be next level very shortly, and that is very exciting.
It is. It's really been a labor of love. I'm glad you mentioned Stephanie. She's obviously been, her and Russell have driven the bus for this for the most part for the last couple of years, as we've been through construction, trying to be the visionaries on what this needed to be, and now having you come in as we approach the operational component, and having you in place is valuable. I know there's a number of people on my team at Midland Health that have helped with design and
Mhm.
set up, what kind of equipment needs are there, what kind of furniture do we need. I know a lot of people on my team, they're not going to work at the Behavioral Health Center, but there were no resources. There was Russell and
Absolutely.
Stephanie, and people from food service to environmental services to nursing
Absolutely.
care. People on my team just contributed their time to sit with architects and sit with Stephanie and Russell and
Yeah.
talk about, this is the way this unit needs to be built. So over time, I know there's a lot of people that won't be working at the
Yeah.
center, but really contributed to get it up and running. And we're really excited to be able to offer this service to our community.
Absolutely. Absolutely. And then the reality is, we're very grateful for everyone that's contributed.
Yeah, you'll find the longer you're here, there's the community support for healthcare is unlike you'd experience anywhere else. But as I tell my team, there are expectations with the gifts that we are given, where they expect us to deliver high quality care. And
Absolutely.
so it's inspiring. It's really humbling when people give you that kind of support. You'll find that it's there for you if you are going to grow services. If we're doing a good job at the Behavioral Health Center and we want to expand, somebody will step up and make sure that we have the resources we need to expand services. And so it's a great community to work
Mhm.
in. I've been here at Midland Health for 17 years, and there's nowhere else I'd rather work, and most of it is because of that community support. It's a very rewarding role that you and I share in our respective facilities. There's really just no other place like West Texas, and nowhere else I'd rather do this work than here. That'll wrap up our show for today. I want to thank Gran for coming on and talking about the Behavioral Health Center. Again, really exciting stuff coming for our community. Nothing like it available in the area right now. Remind our listeners to go subscribe to the Midland Health channel. We are just under 800 subscribers as of today. We're trying to get to 2,500 subscribers by the end of the year. We'll add those links in the comments or in the description for resources for mental health needs if you have them. If you hear this podcast and you think you need some help, there will be some links that you can click on that'll give you some resources that you can access, so that you don't wait to get the mental health care that you need. Lastly, Drop a comment down in the under the video. We're interested in topics that you want to hear us cover or speakers that you'd like to hear from that we can try to get on the podcast. We've got a couple of opening spots through the end of the year that we're holding specifically to get feedback from the community on things they want us to cover. And we'll make sure to try to get those covered by the end of the year. We will run 12 of these in 2026. And we will see what kind of engagement we get from the community. And if our message is hitting, if it's been valuable for the community, then we'll continue to do this in the future. So until next time, thanks for watching the Midland Health Podcast, healthcare that makes you proud.